So tell me what it is that bothers you about your skin.
I'm starting to get some crow's feet here, and obviously I'm trying to hide the age a little bit. So along with the fact that I have some wrinkles here, that it seems, whenever I smile or frown, I'm tending to get these wrinkles, but it's the fact that they're still a little bit permanent right now. Even when I'm not making any expressions, I still see the residuals of that. So I kind of want to make those disappear.
Perfect.
Plus, whenever I smile, I feel like these crow's feet tend to make my eyes look a little bit smaller.
Sure.
So along with the fact that, even when I'm smiling from here, I'd like to have a little bit more lift.
Okay.
So whatever it is that we can do to fix that.
Sure, absolutely. What you're noticing when you smile, there's a muscle that goes around your eyes here that squinches when you smile, and that gives you the lines that are perpendicular to that muscle. But it also closes your eye a little bit because it forces the downward motion of your eyebrow, which is also kind of closing down the outer portion of your eye. We can actually use Dysport, which is a medication that helps to relax the muscles so that when you smile, the muscle won't squinch here.
Okay.
That'll actually keep your eye open when you smile, which I think you'll like. It'll make you have a wider eyed appearance. It'll also lift your lateral portion of your brow up a little bit if we treat this area. It's done with 3 simple injections on either side of the eye into that muscle. It doesn't really hurt much. It's a little tiny pinch.
Mm-hmm.
The medication usually takes between 3 to 5 days to set in and work, so you won't see immediate results today, but you should notice something by a week from now. If you were to still feel that it was moving in a week from now, come on back in, let me take a peek at it since it's the first time you're having this done, and I can let you know if the muscle needs a little bit more of the medication. That medication, the Dysport, then lasts for about 3 to 4 months in most people, but during that time when you're not able to crunch the skin, your skin's always making collagen and it's always being broken down, and if you're not able to scrunch the skin up from the muscle action, it won't get those deep lines in it, so you can make more collagen to even fill in those lines that you're starting to see at rest. So there's a bit of prevention with using the Dysport around the crow's feet to prevent them from getting deeper. Same thing with your forehead. It's a different set of muscles that helps to lift up your brow. Now, because I need your brows to still lift a little bit, we don't want to leave them lying flat because then I think you're going to feel that your upper eyelid feels too heavy. So what we can do is we can treat your forehead muscles, the frontalis muscles here and here, with a little bit of the Dysport, but we'll still allow you to have some movement. Men usually don't like to have a frozen look. They want to have some animation with their eyebrows, but I can give you a lighter treatment so that you can still move your brows, but you won't have the deep crevices in the skin when you do that. And again, by letting the muscle relax, the skin will then start to fill in collagen and fill in those lines so you don't see those lines at rest. It may take more than one treatment with the Dysport for that to occur because it takes several months to build up collagen, but over the course of a year or a year and a half, you should virtually see those lines disappear. If you were someone who had much deeper lines, it might take more like 2 or 3 years for that to occur, but since your lines are very fine, I don't think you're going to have any problem with having them improved with even just one treatment.
Sounds great. My pictures, I'm tending to see my eyes always a little bit on the squinchy side. So
That's small, yeah.
This sounds excellent. Is there anything I have to do after the injections?
It's a great question. So what we ask you to do is to move the muscles to work the medication into the nerves that drive the muscle action. So all that would entail is lifting up your eyebrows a few times in the next hour and a half or so. You don't have to do it all day long. You don't have to do it for 4 hours. If you did it 5 times in the next hour and a half, that's probably plenty. And then also smiling so that you can squint the side muscles on your eyes as well for the next hour and a half. Other than that, the only thing we ask you not to do is have a facial massage today because we don't want the medication to be moved to any other muscles in the area. But you could work out, you could do yoga, you can do anything you normally would do except for having a facial massage for the next 10 hours. You can lie down, you can take a nap, any of those things are fine.
Simple enough. I think I can abide by those rules.
Great. Do you have any other questions at all?
That's it. Thank you very much.
Then we'll get started.
All right. Excellent.